Today's Cardinal lesson, we're talking about original Medicare and the Medigap Plan G. So it's not real original stuff here. If you've watched a lot of our videos, you've heard most of this before. What we want to do today is just give you an explanation and of what it is we sell. And so you go on Medicare, you're going to have to get signed up for Part A and Part B before you do anything. And we have shows on how to do that, videos. And so you've got to get the Medicare with the government, Part A and Part B. And then we're going to talk about supplementing. And the Plan G is the plan that is amongst the 10 plans that you can pick from. So the government standardized all these things several years ago, like 30 years ago. They made them all, and they called them A, B, C, D, so on and so forth. And the G plan has the highest benefits. It's the one that pays the most. And so most of our clients want the best, and that's what this is. And there are 3 states that there is no standardized 10 plans. There are no standardized 10 plans. Massachusetts, Wisconsin, and Minnesota, those 3 states opted out of the standardized plans, but they have something similar to the Plan G. And if you live in one of those states, we can still help you. We're in all 50 states in the District of Columbia, and we're licensed there, and we're familiar with the plans that are available. What I'd like to do is bring Tom on and really just have Tom talk about why we're doing this video today about Medicare Supplement, Plan G, and Original Medicare.
Yeah, I think we're doing this video because we really wanted to show you what our most popular plan is. If you took a survey of all of our clients, and we have a mix of supplements, advantage plans, all sorts of things, this is the most popular plan that we sell. It has the highest benefits. We'll get into those benefits here in a second, but this is it. And I think if you can afford it, and especially if you're having to pay the IRMA and those type of things, this would be what we'd recommend you do. So let me bring up the show notes. You can find these the link below our video. They're also on our website. We're not going to spend a ton of time in here today, but and we'll get to this in a second. But and Hans will talk about this. But if you're on the board, we have sort of different pricing of the different plans, and so we really just have sort of a printout. And this is dependent upon your location, dependent upon your age. So these prices aren't real specific to you, but I'll show you in a second where you can get those pricing. But again, this is an age 70 single male in North Carolina. We have prices for California. I think New York's in here. Again, we sort of just gave you a range of different ones. The other thing that's listed on here, if you get into the details, is really more details than is on the board of like what Part A pays for, what Part B pays for, what the supplement pays, what you pay. We don't want to get lost too far in the weeds, but I do also want to show you one other thing. This is on our website, and you are able to go and actually run this quote for yourself. And so you go to our website, you can find it here under there's a Medicare tab, but you can type in your zip code, type in your age, type in whether you're male or female, and hit run comparison. I did it ahead of time. And so this is for a 68-year-old male in North Carolina. And it just gives you a list of the companies. You don't need to provide your name. You don't need to provide your email, phone number, none of that. And so it's open to you. A lot of times, if you just Google Medicare pricing and you find some quote online, they're going to ask for all that stuff and they're going to call you relentlessly. We're not going to do that. We don't get any of your personal information. It's just a way for you to be able to go and see what the actual prices are in your area.
Okay. So what we're going to do first is we're going to talk about the critical parts of Medicare. If I need about 3 boards, if I was going to list everything that Medicare Part A covers, and I'd need to list everything that Medicare Part B covers, but I've just hit the gist of things of the major components, is that if you're on Medicare Part A and Part B, which you need to be before you start talking to us, or we'll help you get there, then what we're talking about today is the supplement. So if you take everything on the board that's right here, and you just forget about this for a minute, and you look at this is talking about if you had just Medicare and you had no supplemental insurance. If you went in the hospital for the first 60 days, you'd have a deductible of $1,632. So that doesn't sound too bad. you had $100,000 hospital bill, most of it's going to get paid by Medicare Part A, all but 1632. But the problem is when you go in the hospital, you have a whole bunch of expenses under Part B, which is the doctors that treat you, the outpatient stuff beforehand, a lot of lab tests, things end up under Part B. And if you had $50,000 in Medicare Part B bills on the same thing, you'd have a $240 deductible, which isn't much. And then Medicare would cover 80% of the rest of the $50,000, which would be about 40 grand. You'd be left paying 10 grand. Plus, you'd be left paying, because Medicare doesn't pay for charges in excess of what they allow. So the doctors, they have a cap on what they're allowed to pay doctors. And doctors that take assignment work within that. But I'm just trying to show you that it's really the 20% are having to pay that you can't live with, because 20% of a bill that's in the tens and hundreds of thousands of dollars is just too much for anybody to stand. That's why they invented supplemental insurance. Okay. And I want to make the distinction before we start talking. We're not talking about Medicare Advantage here, because with Medicare Advantage, you're off in a whole different deal. Is what we're talking about here is staying on original Medicare, Part A, Part B. We're not going on Medicare Advantage. We're just staying on that. And then we're going to purchase a supplemental plan to fill in the gaps, fill in the things that Medicare doesn't pay. Some people call this Medigap. And then specifically, we're talking about the Plan G, is there's 9 other plans available in 47 states. So you can study all 10 of them if you want. And all the other 9 do is just eliminate some of the benefits of the G. So if somebody starts talking to you about an N plan or a C plan or a D plan, there's something missing. And then they'll, of course, be a little bit less. But what we're going to do to make this simple is we're just going to talk about the best plan, the one with the highest benefits, the Plan G. And it's really not that much more than the other ones. So this is what we end up selling to most people, are the Plan Gs. Now, so what does the Plan G pay? Well, the Plan G is going to, you go in the hospital, it's going to pay that $1,632 deductible. So it's going to leave you with no cost for Part A. And then after 60 days, you've got additional costs, which I'm not going to get into all the details of that, because your supplement, Plan G, pays those. And it'll pay to up to an additional 365 days in the hospital that the Plan G will pick up after Medicare runs out. Under Medicare Part B, this is where the supplement ends up paying a lot of money, is it's not going to cover your $240 Part B deductible. So that's really when you get sick and you have really large bills, and that's where we have clients that call us afterward. They say, I'm waiting for the bills. When are they coming? And maybe they met their $240 earlier in the year, and they've already paid that deductible, and they literally have no cost when they come out of a major expense. And that's because the Plan G is going to pick up all the Medicare deductibles, co-payments, 20%, excess charges of some doctor balance bill. I mean, the whole 9 yards, other than the $240. So I could talk on and on and on about this. It's just, this is what I bought personally, is a Plan G, when I turned 65 last summer. So I want you to just ignore this for a while. I'm going to show you another option of the Plan G at the very end. But what I want to move over to is the pricing. Okay. And I'd really like to bring Tom back on and show you those show notes again, because I'm going to tie them to the video. So if you want to go into the show notes.
Yeah, so let me bring these back up again. They're at the link in the video. And so we'll go down and we'll just look at the North Carolina one initially. And so you can notice that these are just ranked in terms of purely just looking at the price. And so one thing that we sort of alluded to, but we just want to make the point here, is a G plan is a G plan is a G plan. There is no difference in coverage between these options. And so you are literally getting the exact same coverage from all these companies. That's one thing that Medicare came out and did to try to help simplify things for the consumer. You know, unfortunately, a lot of consumers, and you might not even realize this, and so people really get sold on the idea of like, I've had this supplement for, you know, 10 years, it's paid out great, I've been sick, and I don't want to mess with it. Well, you might not be able to qualify, but if you can qualify to switch, there is no reason to be paying more than you have to for the exact same coverage. And so we've ran the quote, we did this on our website, and you can do this like I showed you earlier, and it will really just pull up the list of the plans available specific to your area, specific to your age, and what the prices are for the exact same coverage. These G plans are identical.
Okay, so most of the country is pretty similar to the North Carolina pricing, maybe a little more, a little less. And in North Carolina, we're fortunate that with most companies, there is no area rating. So you don't pay more in Charlotte than you do out in a small town like, Wallace, North Carolina or something where you're um, in a lot of states, that's true. Like if you go to Texas, I ran Houston rates in Texas because I didn't want to give people I want to give you a whole spectrum of the costs. And in Texas, people in Houston pay the highest rates for their Medicare supplements. If you're out in some small town in North Carolina or even in the Dallas area, you're going to be closer to North Carolina rates. Now, what I wanted to show you in North Carolina, you're paying $120 a month for Allstate. You're paying $145 a month for AARP. And so what a lot of people say, well, why wouldn't I just buy the least expensive one? And my answer is go for it. I mean, we represent all these companies plus about 30 more. And we try to have as many of them as we can in an area so we can make recommendations and select, because this varies by state, who's at the top, who's at the bottom. And there's companies certainly a lot more expensive than AARP. I just wanted to show you for $120 a month and $145 a month, you're getting exactly the same thing and everything in between. And so then you go to California, and in California, it's more than double, or it's the least expensive one is more than double, but it's about double. And then actually, if you go to AARP in California, they're only $191 a month. AARP and United Healthcare are AARP is the organization sponsoring it, and the insurance company that you actually have your insurance with is United Healthcare. But when we have people from California call us up, we sell them the AARP United Healthcare. It's $191 a month. Why would I pay $250 or $300 a month for something I can get for $191 a month? Now, we want to go in Florida. In Florida, they're pretty bunched up. They're so regulated that they don't really allow a lot of competition, or if you just look at that. But again, this is just the major companies. There's probably some company you never heard of lower than all of those. We can talk about that with you individually, but all of these companies are selling exactly the same thing. We get to New York. New York is the most expensive place. And we write a lot of this AARP, $306 a month. Last year it was like $280 a month. And I always get a kick out of that when we have people in New York City, Manhattan, the financial capital of the world, calling North Carolina for financial advice. Get a real kick out of that and becoming customers. But New York, $306 a month, which is a heck of a lot more than $120 a month for exactly the same thing. There's a bunch of reasons for that. But when we get into New York, we'll have some separate advice for you. We're just showing comparative pricing here. And this pricing is for a man age 70 who's single and doesn't smoke. And for females in some states, they're about 10% less, sometimes a little more. For married couples or two adults living in the same household, that reduces the thing, sometimes more than 10%. And then this includes the non-smoker discount. So if you're a smoker, you're going to pay more if you go through underwriting. So this just kind of gives what we profiled. But of course, if you want to know your rates, you can talk, to Tom, or you can go on the website, or you can just give us a call. We'll run one of those things in the show notes, one of those rate illustrations, and we'll include all the companies in that. And we'll do that without pestering you with phone calls. So you got Medicare Part A, you got Medicare Part B, you got a Plan G, which fills in almost all the gaps with the exception of it doesn't pay the $240 Part B deductible. So that's going to be your out-of-pocket expense. And then in addition to all that, you're going to need a Medicare Part D plan, a prescription drug plan. We can help you with that too. We're in all 50 states and DC, and we have most of the plans. We don't have all the plans, but you buy a standalone Part D plan. It comes with an annual deductible. It has co-pays, different video. We'll talk about the donut hole, catastrophic coverage. It has a maximum out of pocket. You can do your shopping with us. So now I want to bring Tom back on, and I want Tom to talk about this optional high deductible Plan G. So this is a separate policy, still a Plan G, but it has a high deductible, and it's available from a variety of companies. So I want Tom to talk a little bit about that.
Yeah, I mean, I think it's an option here. The real benefit of it is it lowers the premium. I mean, you go from like $120 a month or so in North Carolina to maybe like $35, $40 a month. I mean, there's a range. But how this high deductible plan works is there's the deductible of $2,800. And so a lot of people might be entering into Medicare. They've always been on a high deductible plan. They're familiar with that. They're comfortable with the deductible. And so say, I'll just get the high deductible G plan. Well, this actually works a little bit better than what you're used to when you think of a high deductible plan. And the reason for that is Medicare is still going to pay their portion. So if we look at the numbers up above on the chart, we'll look at Part B expenses initially. And so let's say you go to a doctor or you have some procedure done, and just to make the math easy, you have Part B a cost of $100,000. Well, the 20% is what the G plan would normally pay, which would be $20,000. Maybe I'll make these 10,000 to make them either way, but you got 20%. How the high deductible plan works is that deductible applies to what that 20% charges that the G plan would have paid, not the full cost. So you still have Medicare paying a portion of your bill even before you've met that deductible. Once the G plan then kicks in, and the high deductible G plan pays the $2,800. Now it works just like a regular G plan, but it's a little bit better than maybe the high deductible plan you're used to prior to Medicare.
It just raises your out of pocket from $240 to $2,800.
Yeah.
I mean, it's that simple. And in New York, it's going to lower your $306 premium to like $110 a month. So you're literally going to save enough in premium to pay the $2,800. But some people still don't want it. They just want to go on Medicare. They want to have their car. They want to have their Plan G. They want to know they're only paying $240, and they don't mind paying the premium.
I will say in most states, how the pricing works is if you get the high deductible G plan and you get sick and you meet that deductible, you're going to have a higher out of pocket cost than you would have if you just went with the standard G plan. And that's sort of the bet you're making. It's like, I'm going to be healthy for a number of years, get to pay this lower premium, save those dollars, and then I'll be able to use that money to offset the deductible in those years that you do get sick. I will say, and that's part of the reason why in most situations we just recommend go ahead and just get the standard G plan, maybe minus those high state areas in New York, sometimes Florida, things like that. The high deductible can make a little more sense because the difference in premium is enough to justify it. But if you're here in North Carolina or something like that, you're probably better off just getting the standard G plan and not worrying about the higher.
Or Iowa or Indiana or
Yeah.
Colorado or most of the country. Most people, even if they have the means, end up going with the regular Plan G. But there's a market for people. And, there's people who say, I can stand that. I've done the math. This is what I want. We'll help you get it. Now, where I want to paint the picture with this is for people who can afford these premiums. And the real reason you want to do this is not because it pays almost all your bills. The reason you want to stay on original Medicare and go with a Plan G, if you can afford it, is because it allows you to select any doctor in any hospital anywhere in America that takes Medicare, which is just about all. And so you don't have a network, you don't have your doctor having to get approval for something they're going to get done or something you need done. You can, if you want to go to a research hospital, you get some serious illness and you want to go to the Mayo Clinic, and they're all over the country, or they're in Arizona and Florida and Minnesota, or you want to go to the Cleveland Clinic, or you want to go to the Houston Cancer Center. You got no issues when you have original Medicare and Medicare supplement. If you're on Medicare Advantage, the downside to the Medicare Advantage is that you are going to have to work with a network, and you're going to have a little uncertainty about who's covered, what's covered, and you get a real bonus for that because generally those things come at zero premium, so you don't have to pay this Medicare supplement. They include a Part D plan, so you don't have to pay for that. They a lot of times include a little dental and things like that. And so if this is a struggle for you, or you're just not willing to pay out of pocket, well then, there's nothing wrong with a Medicare Advantage plan. Go for it. We'll help you do it. And we're not going to be down on it or anything else. This is for the people that want to have exceptional choice in how they receive and where they receive their health care. I mean, it's just kind of that simple. And a lot of times people are paying IRMA, so you're paying much more than this. That's the Medicare tax on the well-to-do. And then they're trying to shave off costs here and go on a Medicare Advantage plan. And it's almost like, well, if you're paying all this tax or excess charge to IRMA, why wouldn't you just go a little further and make your plan the best that it can be? So, that's who we're speaking to today. Now, we want to look here and we want to say, within the scope of financial planning, what have we covered today? Well, we've talked about Medicare and Medicare supplements, and that's kind of about it. I mean, this is a pretty limited subject, but I will tell you this, that most of our clients that come to us for financial planning and retirement planning start here. People on our YouTube channel many times start on the Medicare videos, and they contact us because of our expertise, and that this is kind of the opening of retirement, that and Social Security. So we very much would be glad to help you with this, to explain it. You can find us very easily. I'm Hans Scheil.
And I'm Tom Griffith.
And we thank you very much for listening.
Thank you.